This topic is about cleft lip and palate. So let's first discuss cleft palate and how it can occur. This typically happens in utero when the small bones of the roof of the mouth do not fuse appropriately. This can cause an uncoordinated suck and swallow and cause an increase in aspiration for these clients due to the higher ability for the fluid they drink to come right back up. This hole at the top of the lip can cause issues while these clients try to feed. Cleft lip and cleft palate can commonly occur together, but can also occur separately. As you can see in this diagram, cleft lip and cleft palate can occur or present in many different variations. We can have unilateral or bilateral presentation. So we've referenced a couple times that these clients will have difficulty eating, but let's talk about it in a little bit more detail. Again, we're going to see a poor seal and poor suction due to the hole in the top of the mouth with cleft palate, as well as the hole at the top of the lip in cleft lip. This then causes an uncoordinated suck and swallow reflex, which has high risk of aspiration and increased reflux of the fluid these clients try to drink. Complications that can occur due to this increased risk of reflux or movement back and forth of that fluid are aspiration pneumonia. These clients are also at higher risk for recurrent ear infections. Due to the impaired anatomy of the cleft palate, there's then an opening in the eustachian tube, and fluids can travel back up into the eustachian tube, into the inner ear. Bacteria love moist, dark places. They can feed off those fluids and cause ear infections. If clients are having these recurrent ear infections that become a chronic issue and eventually lead to hearing loss, they may also have issues with speech or possibly language. This also becomes a concern for development. Clients may also experience dental problems due to cleft lip and cleft palate. They may have missing teeth or misaligned teeth that can form. So let's talk about how we can best care for these clients. We want to encourage bonding between families and these infants. These infants typically are not able to breastfeed successfully, and that can inhibit the bonding experience. We also want to encourage families to feed the client in an upright position, and this is for safety reasons to prevent any aspiration. We also want the babies to burp after each ounce of formula that they're able to swallow, and this is because due to the hole in their palate or their lip, they're sucking in more air with each swallow, and so we want to make sure we remove that air so they can continue to eat. These clients typically require a special nipple, as you can see in this diagram, and this nipple needs to be placed in the back of the throat towards the side of their mouth in order to encourage appropriate suck and swallow. So how do we resolve cleft lip and cleft palate? Surgical intervention is the only way to repair these two issues. Clients with cleft palate typically are asked to wait between 6 to 12 months of age so they can tolerate the procedure better and so they can decrease the risk of complications. Post-operative care is really important for nurses, so we want to make sure that you know exactly how to be prepared for these clients when you take care of them. We want to make sure that these clients are not able to access their new surgical site and cause any potential further damage to that new tissue. So these clients will typically be in elbow restraints, so they're not able to bend their elbow and gain access to that newly repaired surgical site. We also want to observe for any excessive swallowing because this is a primary indicator of a fresh bleed. So we do want to communicate this with the healthcare provider as soon as possible. We also don't want to offer any straws, pacifiers, or even rigid eating utensils, and this is so we can decrease any damage to that newly repaired area. So which foods do we want to offer our clients? Since we have this fresh tissue and newly repaired site, we want to make sure we're offering foods that will not cause any further damage. So soft foods, pureed foods, or even blended or modified liquids can be helpful.